So we'll go ahead and get started here. I want to, first of all, welcome everybody to the CHW Circle on this day, July 9th. I'm Vanya Howard. I am a community health worker, and I'm also the Field Experience Apprenticeship Coordinator here at the Alliance. And I'm also a birth doula. I just want to make sure that we create some space for folks here today to introduce themselves. So the question is, we're going to have you introduce yourself, tell us where you work, what your role is, so your title, and what color are you showing up as today? How are you feeling? We have some topics today around our current events related to Medicaid. We want to know, how has this affected your week, if at all? So what color is corresponding with how you're feeling? I will just say that I am showing up today as green. Feeling a little, out of the loop because I'm choosing to when it comes to the news. I kind of got an overload of the news over the weekend, but then coming into the week with it and then having to juggle that news about the Medicaid cuts, as well as be minding my own work tasks, has been a little bit overwhelming. So I chose to unplug from media for a little while. And I will pass it to Kalia. And then Kalia, once you've introduced yourself, told us your title and where you work at and what color you're showing up as today, just call on someone else for me. Thanks.
Perfect. Thank you. Thank you for having me. Can you hear me?
Yes.
Okay, perfect. Hi, everybody. My name is Kaylee. I am a community health worker at the Essential Health First Street Clinic in Duluth, Minnesota. Um, I think the color that I am showing up as today is blue. Feeling a little bit disappointed and a little bit discouraged with what's going on with our current administration and state of the country. So I will pass it on over to Spencer Eichmann.
My name is Spencer. I'm one of the community health workers at the West Duluth Clinic here in Duluth, Minnesota. And the color that I'm showing up as today is purple because I am a mixture of both discouraged, disappointed blue and angry red because the state of the world is very volatile right now and it feels like there's absolutely nothing we can do about it. So it almost makes me think like, where's the future headed? And I'll pass it over to Jessica.
Hey there, my name's Jessica. I'm a community health worker also at the West Duluth Essentia Clinic. And I would probably have to say that I'm showing up as blue or purple. I like Spencer. Yeah, just sad and discouraged and frustrated and all the feels right now. And I'll pass it on to Sam Eats.
Hey, sorry. My name is Sam. I'm a community health worker supervisor with Essential Health, working out of Grand Rapids, and I actually jumped on a little bit late. I'm hearing colors and moods, but I have no idea what's going on.
Yeah, thanks for asking, Sam. So we are letting folks here know what our name is, what our title is, where we work, and given all of the events that have happened over the past several days with Medicaid cuts, and anything else that you might be dealing with on top of that, what color corresponds with how you're showing up today?
Um, I think I'd have to probably agree with blue, um, just simply because little bit discouraged, kind of bummed out, surprised at what's going on. But yeah, I'd have to say that blue is probably the correct corresponding color.
Thanks for
Oh,
sharing. And would you call on someone else to intro and tell us about their color?
yeah, I will pass it to James Walsh.
Hey, thanks, Sam. My name is James Walsh. I am the Communications and Registry Manager at the Minnesota Health Worker Alliance. Yeah, what color am I feeling? Gray. I think I'm a nice stormy gray. It's all this news. The news keeps happening. Everything keeps happening. So things have started to feel not flat per se, but I think I'm kind of got this like stormy rain cloud feeling. I'm definitely bummed out, but there's a nice little bit of rage kind of boiling underneath all of that too. I'm very frustrated, very discouraged, but that's why I'm thankful that we put these kind of things together so we can all talk about it. It really helps to hear. Uh, it's a good sanity check knowing that everyone else is kind of sitting in the same boat, feeling the same way. I feel like we've all been sticking with our own organization, so I'll pass it over to Rachel.
I'm Rachel Stahl. I am the education manager of the Minnesota Community Health Worker Alliance. I am a community health worker, and I made the PowerPoint today about the federal cuts. And I would say that before I made the PowerPoint, I was feeling pretty blue and gray and purple. But now, guys, I'm feeling like action pink. I'm like ready to go. So I hope that I can take you with me on that journey. And we'll see if I'm successful in that. And I will pass it to John. I think there's only one John in here.
Thanks, Rachel. I'm John Fick. I'm the network director for Sanford Health, creating a community health worker hub in a 4-county, 3-tribal nation region of northwestern Minnesota. And my color is probably golden. One of the things that struck me when I was a little kid and was reinforced, I have a master's degree in history before, well, among other things, but one of the things that I've learned is that, you know, in the words of Franklin Roosevelt, the only thing we have to fear is fear itself. And that's been a guiding principle for me as best as I can adhere to it. Bad things are going to happen, and we have to move on. We have to roll on, like Rachel said, you know, take action, solve the problem. And don't enjoy catastrophes, but I enjoy the creativity that you develop when you deal with those catastrophes. So I'll pass it on to Sophia.
Hello, everyone. My name is Sophia. I am a grant coordinator for Sanford Health, and my feeling today is blue. I'd like to pass it on to Aaliyah.
Is it,
lead it today.
is it Ileana?
Hmm.
Is the name pronounced Ileana Brown? Sorry if we're mispronouncing it. Okay, we can move on to Marie.
Good afternoon, everyone. I'm Marie, and I work here at MVH as a cancer qualities improvement. The color I'm feeling today is kind of blue and yellow. So yellow is happy. You know, when you see yellow, you cannot help but smiling. But at the same time, I am feeling blue because there's so many things that happen that totally out of our own control and someone else controlling it. And right now, all you can do is just laugh. Okay, so I'm going to pick on Mariano.
So I'm Mariana, community health worker at Waseca County Public Health. I would say that I have been a mixture of different colors throughout the day. I woke up blue because I was very tired, and then I was a little bit red, a little bit in the blue when I listened to another webinar this morning explaining like all of the changes that are going to be happening, and yeah, so yes.
Thank you, Mariana. How about Sophia? How about Aaliyah? Is it Aaliyah?
I think Aaliyah's microphone might not be working.
Oh, okay. No, we can't hear you. Sorry. Tish.
Hi, everyone. My name's Tish Rivera Cree. I'm with Indian Health Board of Minneapolis. I'm feeling kind of grayish blue. I'm feeling sad, worried, frustrated. I do love Rachel's Action Pink. That kind of ignited a little spark in me. So yeah, and I think I'll pass it on. I don't know whose iPhone. I see one just showing up as iPhone. Um, so I guess that's like that. Thanks.
My apologies. I didn't type my name in. Hi, my name is Josette, and I am a community health worker with Volunteers of America. And right about now, the color I'm feeling is red. Kind of like a little upset about the things that's going on right now, and it's like the news just something's new every day, keep coming. You don't know where to turn, but I'm sure there's a light at the end of the tunnel, but right now, just trying to make understanding of it all.
Absolutely understandable. Sylvia. Okay, I'll just read from the chat for a little bit. Aaliyah, when you have a moment, if you want to put in the chat, tell us where you work and what your title is and what color you're showing up as today, that would be awesome. Sylvia says that she can't join outside of the remote session and can't get her mic or video to work, but she's Sylvia from the CHW program development at Ready, Set, Smile in Minneapolis. And then I will call on Stephanie.
Hey everyone, my name is Stephanie Medina. I use she, her pronouns, and I'm the Infrastructure Program Manager for the Carlton Cook Lake St. Louis Community Health Board up in northeastern Minnesota. I feel like my response is kind of a little bit of a cop-out, but do you remember that carpet in your like first grade, second grade classroom that's kind of every color and no color all at the same time? There's a lot going on, but you feel kind of blah about it. That's how I'm feeling. And I apologize. I am not quite sure who's left.
That's valid what you said. I think I mentioned that before the meeting, Stephanie, that sometimes you can say that you're showing up as like a rainbow of colors, and sometimes the rainbow happens during storms, and it's not always, you know, this pretty sight, depending on the beholder. It's in the eye of the beholder. Eleazar, sorry if I'm mispronouncing your name. I see you may have just joined. We are introducing ourselves, our title, where we work, and what color we're showing up as today.
Sure. My name is Alazar Elias. I work for Pillsbury United Communities. I'm a community health coordinator at Brian Coyle Center.
I'm sorry, I didn't hear that last part.
Brian Coyle Center.
Okay.
Riverside, yeah.
Got it. And what color are you showing up as today? What color represents kind of your mood and how you're feeling?
I would say yellow.
Thank you.
Thank you.
Is it Estefani?
Yes, Stephanie, yes.
Stephanie.
I'm a community health worker at Pillsbury United Communities, Waite House Center, Minneapolis. And the color I am today is white. I want peace. I want everything got fixed soon and we found a solution, and I feel like that is gonna happen. It's gonna be hard, but I know it's gonna happen.
Yes, thank you. Sylvia shared with us in the chat, she's feeling maroon, angry and very confused, wanting to know more about specifics and how this will affect our work and those we serve. Thank you, Sylvia. Katie.
Did you say Katie?
Yes.
Oh, perfect. All right. So my name's Katie Keel. I work for Smock Family Planning down in Southwest Minnesota in the Marshall office. I am an RN and community health worker. And as far as color, I'm going to be honest, I'm unsure at this point. I don't watch a lot of news, so I feel I'm kind of out of the loop of what's going on. So kind of one of the reasons why I joined today.
Thank you for joining. Ileana, I see you popped off mute. Are you okay to share with us your name, title, where you work, and what color you're showing up as today? Okay, how about Nicole?
Yeah, good afternoon, everyone. My name is Nicole. I am a CHW supervisor with Fairview, and I would say I'm pretty similar to Vanya with the green because I've been really trying to stay away from the negative news and really just trying to be optimistic to move the team forward and wait to really see the outcome and try to just kind of wait and be optimistic on what's to come, how we can really support our patients and be there for one another versus what the big noise is right now. We don't really know the outcomes of what's to come. We just know what we've heard. So
Thank you. Ileana was able to put in the chat, her microphone is not working. She woke up feeling blue as well because she was tired throughout the day, and she says, I felt yellow because of the beautiful weather today. And I am a new community health worker at Leech Lake Maternal Child Health. Awesome. Thank you so much. And I think we have Sunny.
Hello, my name's Sunny Ainley. I'm the interim executive director at the Minnesota Community Health Worker Alliance. And I'm feeling, I had to looked at my Post-its, and I decided that this is my color. And it's because that we're all here, and I'm so excited to see all these people that are joining in and vested and passionate about what's happening. So I'm excited for the conversation today, and nice to meet everybody.
Thanks, Sunny. Heidi?
Hi, everybody. My name is Heidi Carlson. I work for MDH in the Healthcare Homes program. And I think I go between red and pink. So I'm angry about these changes. I see the effects it's having on many of our organizations and the panic and fear that it has created. And I'm hopefully transitioning to pink because I really feel like we need to do something about it. We need to make sure people are educated about what these changes mean for everybody. And we need to be activists about it. So I'm feeling ready to go for that.
Absolutely. I think we had a couple more folks join us. Aaliyah, are you ready? We still can't hear you. How about Miley?
Oh, yes. What was the question? I'm sorry.
That's okay. The question is, tell us your name, also what your title is, where you work, and what color you're showing up as today.
Okay, so I'm Miley. I work at Ramsey County, and I'm a community health worker. Color, yellow.
Thanks, Miley.
Thank you.
Emily? Emily, have you had the opportunity to introduce yourself? All right. Want to give Aaliyah another opportunity. We still can't hear you. And Emily says her mic isn't working as well. And that's okay. That has happened this week, I bet, to most of us with technical difficulties. So we'll just continue to move along with our agenda today. As I mentioned earlier, for those who have joined a little late, we are going to just open up a discussion about the current events that have been happening related to Medicaid cuts. We'd like to get your thoughts, but also share some information with you. And then later on in this meeting, we'll also want to hear your input and thoughts and what you need from CHW Circle. How would you like to receive content through this space? This is a space for CHWs where we can share peer connections, but as well as network and learn from one another and other professionals in the field. So we'll get your input about that as well. We want to make it a space where folks are feeling welcome, but also a space where folks are feeling that it's safe to share and where you can learn things from one another. And so I'll pass it over to Rachel.
Okay, I'm very excited about this. So I've got a little PowerPoint and we've got some interactive parts of the PowerPoint. So I'm going to share my screen and you'll see at the top of my PowerPoint screen, can you see, does it look right? Does it the
Yes.
presentation mode? Okay, great. You'll see there's a QR code at the top of this. If you scan that QR code with your phone, you will be able to participate in the discussion through your phone. So as the slides advance on the screen, it'll also advance on your phone. Some of the slides have content and some have interactive pieces. So that's an opportunity, it's an option. Folks do not have to participate in that way. Anytime I ask a question on the PowerPoint with interactive options, you can interact with your phone, or you can just unmute and shout out, or you can stick your responses in the chat and my colleagues, Viney and James, can let me know what those say because I won't have eyes on that. So we're going to talk a little bit about federal Medicaid cuts. I think just to start out, to level set so folks know what we're talking about, Medicaid is a insurance program that is funded by both the federal and state governments of the United States. A lot of the funding comes from federal governments, but states have a lot of discretion in how that money is spent. So what has just happened is that the federal government, the US Congress and the president have signed a law that cut Medicaid in many ways and changed some requirements of Medicaid. It is very confusing because the system is confusing. It's also confusing because certain parts of the law they made confusing on purpose, in my opinion. And they've also made it so a lot of what the hard decisions that will have to be made by states and counties. So some of the stuff we might not feel right away, and some of the stuff might not be obvious that it's because of federal cuts. So I found a really great fact sheet that was published before this final bill was finalized. It was published when the House passed their version of the bill a few weeks ago. So there's a few changes. So some of my citations might differ a little bit just because of, or some of the numbers may be a little bit different because of the shifts that happened with the Senate bill. But we will send out this PowerPoint with all of my citations so folks can read for themselves. But the name of this Minnesota Department of Human Services fact sheet is Federal Medicaid Cuts, an Obstacle Course of Red Tape, Hurdles, and Traps, Pushing Minnesotans Off Healthcare Coverage and Driving Up Costs. So a lot of the things about this plan or this law don't actually change who qualifies. There are some changes to who qualifies for Medicaid, but a lot of it is changing how you get access to Medicaid by intentionally making it more difficult to access. So we'll go over that soon. But I really love this title so much I couldn't come up with something better myself. So I just put it in quotes and stole it. So first, I want to ask the group, and again, this is something you can use the QR code to post responses, or you can just shout out or put in the chat. What do we already know? What does this group already know about the federal Medicaid cuts? If everybody knows a lot, I can go fast. And if folks, it sounds like a lot of folks have been trying to keep away from it because it's overwhelming. So if anybody wants to throw in their own comments, what do you already know about these cuts? So UCare has cut Medicaid from 11 Minnesota counties. There's a delay after the midterms. UCare cuts, not enough, but still enough to affect my sanity. Foreseeable outcomes. It will affect our community. So there's some things we know here, right? The UCare has been in the news here in Minnesota. So next, I'm just going to go to the next slide, and this is about, we already went over this a little bit, but this is sort of how are we feeling about the Medicaid cuts how do we feel as we enter this conversation? I know we talked about feelings with our colors a little bit, but if folks want to throw down some feelings, you'd be welcome to. Okay, so nervous, worried, discouraged, scared, sad, frustrated, uncertainty, disgusted, despair, grim, hurt, sad, disappointed, unsure. So these are some big, rough feelings. Thank you for sharing that. I just want to kind of ground us in where we're at. So the next few slides is just going to be information about what do we know. Again, you'll see little citations. I'll send out this PowerPoint, or ask James to send out the PowerPoint slides that will have the citation. All of my citations are links in the notes of the PowerPoint, so I will send out the actual PowerPoint instead of a PDF so you can see these notes. But it's aimed at reducing federal Medicaid expenditures. It introduces administrative hurdles and eligibility restrictions. So again, the administrative hurdles piece is meant to get people to mess up in some way and get themselves kicked off. And they estimated the $500 million annual loss of federal funding for Minnesota. So that includes a 10% FEMAP reduction for states covering undocumented individuals. Minnesota does cover undocumented children. So that'll be $330 million a year. Ban on federal funding for gender affirming care. Moratorium on new provider taxes, which threatens our funding model. We'll talk more about the new provider taxes later. I had to do a lot of research on that as I was preparing for this because I did not know what that means. And then limits to retroactive coverage for 1 month. So many of us have used Medicaid. I was on Medicaid for several years, and many of us have had the experience with ourselves or our participants in our programs where somebody was uninsured, we got them on Medicaid, and they were able to have their bills paid 3 months back. This new bill means they will only be able to pay bills 1 month back. So there'll be higher medical debt and worse outcomes for families.
Rachel, can you hear me okay?
Yeah, go ahead.
Can you hear me okay now?
Yes.
Oh, good. I fixed it. Could I share? I'm so sorry. I'm really sorry.
That's okay. We're so glad we can hear you now.
Yeah. So my color is black. I am feeling fearful. I'm really fearful. There's so much unknown, and it's just it's devastating. It has been devastating for the last couple of months. And this new bill, it's not one beautiful bill. It's one ugly bill. It's a mess. So I'm frustrated, like everyone, all the other community health workers stated, and I'm angry.
Thank you for sharing that.
Yes.
Thanks, Leah. Okay, so then just impact on Minnesotans a little bit more specifically. We could have 250,000 people lose their Medicaid coverage. There are 9,300 jobs at risk. So healthcare support workers, that might include some of us. There's going to be work requirements and eligibility checks every 6 months. So we all know how easy it is for our participants to get kicked off the program if they miss that year annual renewal. This means that will happen every 6 months. And one of the things they did during COVID was eliminate those renewal periods because they know that people who do qualify get kicked off if they don't turn their paperwork in appropriately with renewal. There will be higher out-of-pocket costs. So instead of everything being free, a doctor's visit might cost $35 instead of be fully covered under Medicaid. Counties and hospitals will face lots of added costs. Greater Minnesota hospitals are especially vulnerable. There's a huge cuts to family planning services. I heard some SMOC folks on the call. There's family planning is specifically called out for these cuts, and that's $170 million a year. And then there's going to be what is being called an enrollment churn. So that is folks who are getting churned out of Medicaid just because they didn't do all their paperwork perfectly. And then again, those who are able to remain on Minnesota Care or Medicaid will have to pay out of pocket instead of things being fully covered. Potential impacts on our profession. So one thing we've always talked about is that reimbursement rates for CHWs are not high enough, and there is a potential for the reduction of reimbursement rates. So one more thing to just emphasize is that this federal bill did not determine or change reimbursement rates, but they've created a situation where Minnesota is going to have a lot less money, and our state legislature and our counties are going to be forced to find money somewhere, either by making their own cuts, by reducing, and one of the things they could do is reduce reimbursement rates to save money across the board. So where we've been advocating to increase reimbursement rates because we know that they're not funding the CHW profession, this bill could non-directly impact those reimbursement rates negatively. There's program instability. We all know that CHW programs some are dependent on Medicaid, some are dependent on other funding sources, and there's a lot of uncertainty. And then increased administrative burden. So, right, new eligibility and verification rules are going to double workload for county employees. We all know that county employees don't have a lot of extra time. Like I've spent a lot of time trying to help folks I work with navigate county systems, and those folks are already overburdened. But if there's going to be work requirements for certain people on Medicaid, so there are going to have to be people who take those proofs in, right, and verify those proofs. And I don't think there's not funding to hire more people, right? And then there's a huge threat to rural hospitals. So rural hospitals may close, which could increase the distance of travel to receive care, which we already know is a huge problem, especially in northern Minnesota and all over rural Minnesota. Community consequences, like all of us care about our own profession, but all of us got into this profession because we care about our communities. We know what this is going to look like, right? We've seen this. So there'll be access gaps. People will lose access to culturally competent care. There'll be wider health disparities, and thousands will lose health insurance and access to preventative care. So the worst impact, as we know, always is on the most marginalized communities. So Minnesota has been working really hard, especially since 2020, to try to reduce gaps and health disparities, and this is going to sort of exacerbate those. And when can we expect to feel impact? So this is my last sort of lecture-y slide. There's some immediate impact. As I said, reproductive care was very much targeted, and Planned Parenthood was targeted specifically. So Planned Parenthood North Central states, so that's Minnesota, North Dakota, South Dakota, I think is Planned Parenthood North Central states. They've lost access to already. So a lot of these cuts are going to come later, but they cut off Planned Parenthood immediately, and it's $11 million in Medicaid's funds, and they've already announced clinic closures, and most of those clinics are in rural settings where there's not a lot of access to reproductive care. And then, as folks mentioned earlier, UCare has announced cuts to Medicaid coverage in 11 Minnesota counties effective September 1st, impacting 88,000 Minnesotans. And then just the longer term impact. And this is a quote from a CBS News article that I cited here. This bill is structured so that most Americans will feel the impact of tax cuts related to this bill in the spring of 2026. But some of the provisions, like work requirements for Medicaid, do not take place until 2027, which is after next year's midterm congressional elections. So this to me shows me that these folks knew they were doing wrong by this bill, and they wanted to make it look like wasn't them, right? So whenever you put the carrot ahead and the stick is later, it just feels really, that part feels really yucky to me. So now, with this new knowledge that I gave you, how are we feeling? Same feelings, different feelings? If everybody wants to, I'll pop this QR code again. Let me know if any of your feelings change with this information. More informed. Still so mad. Yeah, me too, man. Any other feelings? I know we're doing a lot of feelings today. Despair, pissed off, nauseous. We do this in the word cloud so people can say pissed off and so they don't feel like they have to say it out loud. You're making me say it. That's all right. Yuck, angry, grim, despair. Yeah, so instead of feeling sad, we're now feeling a little bit more, there's a little bit more anger here. I like the emoji. I didn't know we could do that. Need to smash room. Infuriated. Yeah, yuck. This is really tough stuff. And I think the reason a lot of us have been avoiding it, and the reason that you may have been avoiding it on the news but came to this space, is that stuff like this is really heavy and none of us can carry it alone. So we are here to carry it together and to talk about where we do still have power. So there's a lot of powerlessness that can come when these things happen. And there's nothing that any one of us can do that will replace 500 million of federal funding, right? Like that is not something that we're not going to have like a chicken queue and raise $500 million for our communities. So it's really tough and it's structural stuff. But we are here together to move forward and to know that we aren't alone in this and that you're not the only one who's angry and you're not the only one who's sad and you're not the only one who sees the negative impacts this will have on our communities. So the next question, to sort of turn that anger into something else, how can we as CHWs help our patients, help our clients, help our communities navigate these cuts? Like, what can we do on an individual level, and even thinking more broadly, what can we do collectively to move this forward? So folks can stick it with a QR code, or they can shout out, what can we do? Continue, show up, be there for them.
Sorry, I didn't use the, sorry, I just.
Yeah,
I
shout
sent
out.
it on the chat, yeah.
Yeah, provide information. Go ahead. Do you want to speak, Aaliyah, about what we can do, what you want to do with for your community in these times?
Yeah, I think a lot of people, a lot of clients and patients are frustrated. So definitely, you know, providing genuine empathy, active listening, just stating that you know, I'm here with you. I'm here to help. I'm here to help. I'm here to listen, and trying to be resourceful. Do anything you can and everything you can to, you know, go online and find resources. Look for something. You know, I mean, because it's just, yeah. Even if you don't find anything while you're just searching on the web and trying to be resourceful, that gives them a comfort that, you know, someone is there for them, someone is working for them, just for them knowing that, it gives them hope. So doing, you know, I mean, yeah, everything. I'm currently not working, and I just got my certificate in May. Gratefully, I do have I'm invited to the Native American Community Clinic in Minneapolis tomorrow to do 2 hours shadowing for the yeah, as a registration coordinator. So I'm excited and grateful, and I do have a couple other ones coming up, interviews. So I want to invest my time and energy in, you know, underserved communities and do what I can, because without those communities, I wouldn't be here. I mean, without the CHW, you know, the Community Health Worker Alliance, without, I mean, other organizations, nonprofit organizations, I would not be here. And you know, so I know what it's like to be neglected and ignored. So just doing our best, all of us. That's all we can do.
Thank you.
Congratulations on your academic success, Aaliyah.
Oh, thank you. Thank you. I wanted to email you back. But it's just been like so much going on. And so I really appreciated all your emails and getting back to me. So I'm grateful to have you in my life.
Yeah, wonderful. Okay, so I'm seeing a lot of things that I know CHWs do all the time, right? So it's just us continuing to do the work. And so I'm going to go to the next slide and just open it up for discussion a little bit too. So in my opinion, these cuts, especially because these cuts are meant to make it more difficult to navigate these systems, this means that CHWs are more important than ever. And so again, like I said, the federal cuts have been sort of decided. The state needs to decide what they're going to do and how they're going to reallocate funds to make this work. And I think we can all say loud and clear, they cannot cut us. Like, we are more valuable than we've ever been, and our communities need us now more than ever. And CHWs need to continue to be invested in. So the last slide was kind of what can we do for our clients, but I want to just stop sharing for a second and open it up to talk about what we can do for for our, what can we do on a structural level to like advocate and make sure that we don't get cut as bad as Medicaid get cuts, and that we are still have our jobs so that we can help folks through this. So does anybody want to come off chat and talk about structural advocacy things they're interested in, or things they want to bring up to make sure that we are showing our value?
I was going to just add, in thinking about Rachel's question, also think about how does this news relate to your specific role where you're working at? Are you someone, a community health worker that assists people to navigate insurance? Are you someone who assists people to sign up for SNAP benefits or MNsure or anything related to social determinants of health when it comes to their finances? So think about all of those things within Rachel's question as well. I know for me as a birth doula, I may be needing to help some folks as a CHW to navigate their health insurance because their doula service is covered under Medicaid. And so in order to continue their perinatal service as well as to have their birth covered, they're going to need to have active insurance on the date of their delivery as well as prior to that. So I knew very early on when I got into the doula field that the CHW role aligns with that work when it comes to resource connections and the population that I serve. So that's one thing that I know that I will be facing through this news.
Well, and I think speaking of doulas and community health workers, especially in these rural communities where birth centers and hospitals may close, people are going to need doulas by their side to tell them when to go drive 2 hours to get to the hospital, right? So in our rural communities, especially where there's going to be care closures, especially around reproductive health and those things, all these roles are just going to be so much more important than they've ever been before. So I'm going to go back onto our mentee here and just ask you guys, what do you need from the Alliance, from Minnesota Community Health Worker Alliance as you navigate these cuts? So I'll put the QR code back. You can use the QR code to, what we can do is rank these. So it'll show up on your phone and you can move them around with your finger and we can see what we all kind of, it's sort of a ranked choice voting activity. So folks want to move them around, see what you think is most important for the Minnesota Community Health Worker Alliance to support you. We want to hear that. And if there's something that you want the Alliance to be doing that is not on this list, we'd love for you to put that in the chat.
Rachel, I put something I would like the CHWA to consider.
Right.
Aaliyah wrote, low health literacy is a problematic for millions of patients, and medical terminology is very complicated, and medical professionals don't educate their patients or clients. You want to say a little bit more about that, Aaliyah, when you said that the medical professionals aren't educating their clients? Does that, in my mind, how I process that is that maybe they're not explaining things in a simplified way as far as education. When you talk about medical terminology, I completely agree with that.
Yeah, they don't use plain language. They use very like big words and you know, someone who probably doesn't have a high school diploma. How can you expect them to really understand that, you know, massive medical terms? So they don't use plain language. I'm not sure why. They already have the job, so I'm not sure what they're trying to, you know, showcase. But yeah, that's what I meant. I mean, they don't really. I think educating. Even sometimes I feel maybe the medical professionals need to be educated how to work with, you know, clients and patients, and they just stop using this, you know, complicated vocabularies of medical terms. Sorry, that's what I meant. So,
and likewise, even with navigating the social service and human services systems, we're going to have some folks, obviously, who don't know how to navigate that system. They need to either have someone do that on their behalf or be educated on how to do that and to be self-sufficient in that as well. Sylvia says, I think as an advocate for the CHW role, I see the growing need for culturally aligned and accessible CHWs for the community. As the system becomes harder to navigate, the navigators become even more important leaders and resources. Absolutely, Sylvia.
Yep. All right, anybody else want to rank these guys? Looks like legislative advocacy was really high on this list. Because like we said, the state and the counties are going to have a lot of decisions to make, and they're really hard decisions. So I think making sure that your local legislators understand the power of CHWs and what you are doing in your community to make your community healthier is really important. And I think the Alliance can be a leader on that. So thank you for those folks who participated. So that's the last slide I have specific to the Medicaid cuts. And we just want to take the next 10 minutes or so to talk about the future of the CHW circle, sort of going off of what the Alliance can do to be most supportive of you. So I think I just want to open the space up if anybody has any last minute or last thoughts to share about the federal Medicaid cuts in this space, and then we'll go and do a few more little activities about the future of the CHW circle. Does anybody else have any last thoughts they want to share around the Medicaid cuts? Something that I started doing was reminding clients not to use social media and what their friends and family is saying as a news source. Yes, thank you. That was said in the chat. I totally agree. I think I did a lot of that during COVID with people understanding the vaccine and other COVID measures to use trusted news sources. And I think as community health workers, often people do trust us. And I was often able to use motivational interviewing and accurate information during the pandemic when I was doing home visits and meeting with participants. People really did change their minds, even with one conversation with me, because I was someone they trusted. And I think that's what community health workers bring to public health, is that we're trusted members of the community and people believe us when we give them. And then there's a hope that we would consider adding 1 or 2 health literacy course lessons to the certificate program. Yeah, that's interesting. So maybe adding to the CHW certificate program has a health promotions class, and maybe having more health literacy content in the health promotion to make sure that everybody's ready for that.
Yes. Yep.
Wonderful. Any other last comments before we talk about the CHW circle? All right. So we at the Alliance, we're looking at the CHW circle. We think this is a really, really important space, and we want to keep it, and we want to make it as useful for you guys as possible. So I went a little bit crazy with these Mentimeter things. I think they're really fun. So this first question is, over the years, the CHW circle has had both peer-to-peer discussion and lecture and educational content. And the question is, what % of the circle should be each of these? Like, what amount? So for this activity, you can give a 10 out of 10 or between 1 and 10, and then we can see what people think is most important. So you could do, if you think half and half, you do 5 and 5. If you think all peer-to-peer, no discussion. And then if you think that there should be some other element, you can add that and then put it in the chat. Oh, it's actually 100. So go all the way to 100. And this will kind of, is this fun? I'm like such a Mentimeter nerd. Sorry, guys.
That's good.
I love it. All right, we've had 4 responses. Anybody else want to? Okay, we've got a question in the chat about the CHW certificate. I'll answer that while folks are continuing to do the Mentimeter. So there are 4 schools that are currently offering the CHW certificate program, and they are Northwest Technical College, Normandale, Minnesota West, and St. Kate's. All of them are fully remote, except for Normandale Community College is hybrid. And there is a part of our, James, if you'd be able to find the CHW education page on our website, I think we list all the schools in Lincoln. We could send you a chat. Ooh, somebody said something else. What's if the person who said something else is brave enough to add it in the chat, we would love to hear what that something else is.
That was me. I take CHW polls because I'm a CHW. And so the something else for me would be things that are maybe going to help us to interact with other CHWs in the community outside of virtual space. I'm one of the CHWs who, again, came up back in the day as a certificate holder and was able to benefit from outreach activities and events and being out in the community. And so something else for me represents those types of activities.
Get off Zoom. How many Zoom meetings have folks have today? This is my 5th. It gets intense, and I would love to see all you guys in real life. All right, thank you for those responses. Our next question is, how long should the CHW circle be? So it has been an hour and a half traditionally, and we've got 4 options here: 30 minutes, 45, 60, or 90. So 90 is what it is now. And we'd love to hear what folks think. How much time do you want to commit to this CHW circle? Got a couple saying 60 minutes.
90 is good.
90. We got one who says 90. I'll put that 90 in for you, so you're represented. Okay, we got 2 for 90.
And keep in mind, this is a monthly meeting, so
once a month, yeah.
Yep, once a month.
Well, that's the next question: is how often should they be? Spoiler.
Yep.
We had another 60 in the chat. James just put that educational opportunities for CHWs in the chat. Thanks, James. Okay, so folks want longer meetings, either 60 minutes or 90 minutes in this group. And we are going to do further outreach. It won't just be you guys. We want to hear from lots of CHWs. We know not everybody's in this room. Next question: when should the CHW circle take place? So right now it's 3 to 4:30, but I've got other options here. So I've got 7 a.m. if anybody's an early bird, noon, 3 p.m., 5 p.m., or 7 p.m. Would anyone, and I know we all were able to be here at 3 o'clock today, so this is going to be a little bit skewed. But if folks think it would be better at the noon hour, or if they think it would be better before or after work, we're curious to hear that too. And again, we're going to send these questions out to a broader group, because obviously everyone in this room was able to come today at 3. So we're seeing a couple people who like 3 o'clock. For me, 3 o'clock is my tired chocolate time. All right. Anyone else want to throw down?
I think 3 o'clock's good. Sorry,
Oh, that's okay. We're open. 3 o'clock from Tish, 3 o'clock from Aaliyah.
Yeah.
No one's going for my 7 a.m. That's all right.
Well, okay. I actually get up like really early, like 5 or sometimes before 5. But people are not. Our brains are not fully wake up yet. So
yeah, that would have to be a free. We'd have to get coffee DoorDash to everybody.
Yeah.
We have Tish and Minister Dr. Ora Holtz, as well as Mariano. They all say 3 p.m. is good.
Yeah. And like I said, we've got a little bit of bias because we all were able to make it here today. So we'll make sure we keep asking other folks. All right. Last call. Thank you. And then how often should it be? Monthly, weekly, or quarterly? So quarterly would be every 3 months. Weekly would be once a week. So like the same day every week. And that would be maybe like a 30-minute, each question, if it was every week, it would probably only be 30 minutes and be just more of a check-in. We got 4 for monthly. Folks, you like it how it is. We love it.
Add me 5 to the monthly.
All right. And Tish said monthly too.
Yeah.
My donut's not going to be pretty if nobody says anything else. There we go.
1 weekly.
All right. And then any discussion on this, like what are your guys' hopes and dreams? What would make this meeting really meaningful to you? What do you want to make sure we keep? What do you want to add? What else can we speak about with the CHW circle? I'm going to stop sharing so we can see each other, those of us who are on.
So in the past, those of you who have joined CHW Circle, it's been about lots of folks coming to the circle with information and trainings, but also folks coming into the space to share topics that affect CHWs in the field, resources that CHWs can be sharing. Is everyone okay with that content, or is there something we could change to make it a different space or a more interactive space or more informational space? What are your thoughts on those? Feel free to just pop off mute and shout it out. Or put it in the chat. Those folks who have been here before, do you like the content the way that it is? Is there enough variety for you?
Could I put something on the chat?
Yeah, please. I see in the chat, providing updates, training, and resources is called out as important. Great. And then I'll just share the last slide, just our next step slide. So the CHW Circle may shift. A lot of the feedback we got was that you guys like it how it is, sort of either 60 to 90 minutes, about 3 o'clock once a month was what the most popular choices are. And that's what's been happening. So like I said, we're going to send a survey out to the entire mailing list of the CHW Circle and just make sure that we're countering any of that sort of bias of folks. It's easy. You were able to come at 3, so we know that 3 o'clock works for you. So we want to make sure we engage other folks. And then we'll just let you know. So we are going to continue to shift to meet the current needs of CHWs. We might be doing some experimentation. And we're going to continue to gather feedback if we do any experimentation or pilots, and then communicate the changes going forward. And that is all I have for today. So we're right at 3:58. I'm going to open.
I'm sorry.
Oh, thank you. No, I see you in the chat. Having discussions and being vulnerable with each other is really important. Having a safe space. So I think it's about at the hour right now. So I'm going to go ahead and close the meeting officially.